Thank you, Mr. Chairman, and thank you, Representative Ocasio-Cortez and all the advocates who made this hearing possible. And Mr. Chairman, just picking up on some of your commentary and the comments of our colleague across the aisle who was very impassioned, and I have an equitable amount of outrage about the fact that people are dying. This is not about the vilifying of profit. This is about the vilifying of choosing profit over people. And if we know that a new person is infected every 15 minutes, and we've been here 2.5 hours, that's 10 more people who have been infected. And so we have an administration, the occupant of this White House, who sets an aspirational and achievable goal to end this epidemic, and yet we don't have enough infectious disease doctors. We have a cost-prohibitive, life-saving drug, and it is not equitably being accessed. So that sounds like an unfunded mandate, and we've been here before. And this is the Oversight and Reform Committee. And so it is our job to hold everyone from, I served on the city council before, but anytime profit over people, whether it's developers or pharmaceutical companies, are engaging in those practices, we're here to shine a light on that and to keep us all accountable. So that's the role of this committee. We should be furious about what we've heard here today. This is the world's wealthiest nation. There are 40,000 new HIV diagnoses each year. In my home state of Massachusetts, there have been over 140 new HIV cases since 2015, 8 new cases in Boston over the last 6 months. Now, we've heard a lot of sobering and damning statistics here, but I don't want us to get lost in the numbers and allow that to dominate the conversation, because this is about people, our family members, our neighbors, our friends, our constituents. Like my constituent, Matthew. He lives in Somerville. He's a gay man. And Matthew knows he's at a higher risk of getting HIV, and for 3 years, he's been fortunate enough to be on PrEP. His insurance coverage gives him access to the drug at an affordable rate. However, he lives in constant fear that a job change will push it out of reach for him. There are millions of Matthews in our country for whom PrEP allows them to stand in their truth, safety, and unencumbered by the fear of contracting HIV. But unlike Matthew, there are millions more who need it and still cannot afford it. It's been 40 years since the first HIV case in the US, and this disease still remains a global public health challenge. And as reminded to all of us by our chair and your earlier commentary, particularly for women and queer people of color. It is my opinion that Gilead, you have used your power to manipulate our patent systems, monopolize the marketplace, to line your shareholders' pockets, and I think that's shameful. Dr. Walensky, you have studied HIV transmission closely, and as a physician at Mass General Hospital, you were on the front lines of this epidemic. Since we're short on time, yes or no, do you agree that by failing to get PrEP in the hands of those most at risk, including people who inject drugs, we undercut our ability to eradicate this disease?
Yes.
Thank you. Can you speak to how substance abuse disorders, specifically for those who inject drugs with needles, have heightened the need for greater access to PrEP?
Our hospital is full of injection drug users right now. We have doubled our consult volume in the last decade, much due to injection drug use. There's been an outbreak in Lawrence and Lowell, as you know, in Massachusetts, that was reported in the MMWR by the CDC. An HIV outbreak, I should say. Yes, we need PrEP for all people at risk.
Mr. O'Day, Gilead plans to donate millions of bottles of PrEP and bring a generic product to the market in the next few years. At face value, this seems like a good idea, although 2 years is 2 years too long. But the CDC estimates only a fraction of the 1.1 million people who need PrEP have access to it. The donation your company announced would reach even less people. Now, I recognize your company's efforts to provide financial assistance for people without insurance who can't afford it, but given the uptick in HIV infection, these efforts simply don't keep pace. They don't go far enough. Mr. O'Day, can you guarantee that the donated medications will go to people who do not already have access to the drug?
Yes.
Thank you. In Canada and Australia, Truvada is sold for less than $10 a pill. It seems to me if your company wanted to, you could make the drug affordable for everyone. What has stopped your company from lowering the price to a comparable rate in the U.S.?
The patent exclusivity ends, as you know, in September of next year, and we will, the pricing between the countries is very different. It's a very heterogeneous systems between the United States and in other countries. And the pricing as set in the United States takes into account the innovation it brings, the cost of the healthcare of treating an HIV patient, the ability to invest back in research and development, and then also to make sure our access programs are effective and that patients in America do not go without receiving this life-saving medicine.
Well,
It's greed.
yeah, okay. So I was going to say, just, respectfully, in that every 15 minutes a new person is infected, the more time we waste, the more lives that we are losing. And again, this is an aspirational and achievable goal. And so it is really infuriating. There are clearly many barriers people are facing in accessing this life-saving medication, and price should not be one of them. Gilead can make PrEP more affordable in the U.S. and therefore more accessible if you want to. If there is the moral courage and the fortitude and the commitment to do so, your failure to do so is indefensible. Your company brings in record level profits while holding hostage a drug that could end this epidemic. There isn't a country in this world where this type of greed and conduct would be tolerated, so I'm not sure why we tolerate it in this one. Thank you, Mr. Chairman, and I yield back.